I'm Dr. Eva,
And I'm Dr. Ciri.
and welcome.
Welcome back to Sistas in Medicine. Today we're going to be talking about STDs. So, Dr. Eva, what do you want to tell the people about STDs?
Girl, where do I even start? It's so much to talk about. STDs is a very serious and important topic. I feel like it's something that needs to be discussed. I feel like our generation probably needs to know that anyone that's walking around just because they look clean, they
Look,
look good, right? Look, that doesn't mean that they don't have an underlying issue such as an STD. So
one of the things that I think a lot of people don't know is that there are STDs that condoms can't protect against.
exactly, that's true. That's true. Because we're always told to use protection, use protection, use protection. But protection doesn't always protect you from every single STD.
Exactly. And mainly the ones I'm thinking about are the HPV virus, and the herpes virus. To my understanding, the HPV virus isn't curable. It's something that your body can clear over time, but there's no cure for it. Just like herpes, you can treat a herpes outbreak, but there is no cure.
That is some scary stuff. Once you catch it, you have it for life. And like you said, you can treat your outbreaks for herpes. But that's the only thing you can do. Every time you feel an outbreak is about to come, you can treat it to minimize the severity of it and the length of time that the outbreak will be going on for. But once you catch it for life. Just like HIV. Once you catch it for life. And so that's why it's very important to make sure that you know the person that you're about to have relations with, that you get tested together before you even start to have any kind of sexual encounter with them. And it's also important to tell people too, just like you said, condoms don't always protect you from every single kinds of STDs, that oral sex also does not protect you from STDs. And sometimes people think it's just intercourse. They don't think that oral sex can actually be a problem as well.
And it definitely can be. I know for the HPV virus or the human papilloma virus, women end up with cervical cancer as a result of the HPV virus. Men, a lot of times, can end up with throat cancer because of the HPV virus. For men who have sex with men, they can end up with anal cancers. Like, these viruses can lead to really bad things. And I don't think people understand that.
I don't even think they know that.
Right. And what do you think about the STDs that don't have any symptoms associated with it? Like chlamydia may not have.
Yeah. Even gonorrhea, sometimes you don't have any symptoms. And that's the thing that's even more scary about it. You know, you're walking around for months, sometimes even years, with the virus, or, well, gonorrhea and chlamydia are not viruses, but you're walking around with the symptoms and the problem for years to months, and you end up having chronic issues. Like for women, you can have infertility
Mm-hmm.
because of chronic infection. And so those are very serious issues too. A lot of women are walking around with those infections for months to years, not knowing that they're infected until they randomly go and get tested just because they feel like getting tested, or until they run into infertility issues and then the workup is done. And at that time, that's when they're told, hey, by the way, do you know you're positive for such and such and such? And they had no idea. So it's very, very serious. It's very, very important that you don't just um, have sexual encounter with anyone that you don't know their sexual history. And even if you think you know their sexual history, do you really know it? The best thing to do is to go and get tested together. Why not? If we're going to sleep together, we might as well go and get tested together. It's better for both
What do
people.
you think about what's going on in, like, I don't know, the celebrity land where there are these certain entertainers that have babies with multiple women? I mean, from a biological standpoint, there's only one way to really make a baby like that, and condoms are not involved in that process. So, what are your thoughts About that, do you think that speaks to the fact that like condoms are just not a popular thing anymore? Like people are just having sex willy nilly, catching stuff, spreading stuff, making babies.
I think that once again, it stems from educating people. If you don't know, then how are you going to be able to make a better decision, not even knowing that there's a risk? Plus, because you don't know the risk, and sometimes people have the misconception that STDs is associated with a dirty person. And so when they see someone that's good looking, clean, smells good, dresses nice, looks like they take care of themselves, they automatically assume that that person is completely clean on the inside too. And that's very false. And so I guess with celebrities, it's very it could be very difficult for them because they have the constant amount of people trying to get with them. You know, like if you are male celebrities, you constantly have females trying to get with you. And so sometimes it's very difficult to make the right decision in the heat of the moment.
Right?
And things happen. Yeah, heat of the moment and things happen. I think you always need to be prepared. Have a condom in your wallet, in your pocket, in your car. I mean, anywhere
Yeah.
that you think you may be able to sleep with someone, just have a condom there. It's better to be prepared than not
And
to
that
be.
goes for women too, right? Like,
Yeah, of course, it's vice versa. Men having sex with men, women, or men having sex with women. It doesn't matter. It's still sex.
right.
More people know about HIV than the other kinds of STDs.
Mm,
I feel like all equally important.
exactly.
Because if you can catch HIV, you put yourself at risk to catching anything else. And so, what do you think about HIV? Tell me what you want the public to know.
So, one of the things that I think the public should know about it, and I will never tell my children this, so, but the public should know that HIV is no longer like a death sentence. Like, there are medications that people can take to get their viral loads down, and so they can walk around with undetectable levels of the virus and be completely fine as long as they take their medicine. Now, when people don't take their medicine, the bad thing about HIV is that your immune system is super weak. So you can contract other types of infections, and those are the things that ultimately kill people who have HIV, those opportunistic infections. The type of infections that you or I could get, and it wouldn't hurt us, but someone with HIV gets them, and it's a wrap. So I think that people should know that part about it. But I also think that even with that in mind, that it is something that you can live with and live a long time with. It's not something that you want to catch ever.
That being said, you're right. It's not something you want to catch just because we have good medicine. We do have a lot of great medicine, and I like the fact that the awareness has been put out about HIV, so everybody knows what HIV is, and almost everyone knows how you catch HIV. But they don't know much about the other kinds of STDs. But with HIV, the medications that we have are so good that if you happen to be one of those people that caught it, it's okay. You can still have a normal life as long as you continue to live healthy, protect yourself still, and take your medication and see your doctor like you're supposed to. Your immune system will maintain, your immune system will be fine. Now, there's a misconception and a myth out there that once you catch it, if I got it, you got it, then it's cool. We don't gotta use protection. You got it, I got it. We all right.
No.
But no, that is a myth because your kind of HIV may not be my kind of HIV. And that virus is super duper smart. That virus is always replicating and always trying to find ways to be ahead of the medications that we have. And so just because I have HIV doesn't mean what you have is the same that I have. And so my medication that has been keeping my virus under control
May not
will
keep.
not work anymore if I catch your type
Mm,
of HIV. And so people need to know that too. And I don't think they know that.
right.
Once you catch an STD, it should be an eye opener to like a warning to tell you to be careful next time. And so use protection always.
Say that someone is going to get tested annually for STDs, and they're being really responsible about who they sleep with. But let's say something bad happens. Let's say someone is assaulted one night. Like, what are they supposed to do in terms of figuring out whether or not they have an STD, reporting the incident, all of that kind of stuff? Like, what do you think about situations like that?
That's a great question. If you get raped, you get assaulted, or something happens that you did not have any control over, say if you get drunk and you don't even know if anybody assaulted you, I mean, you're going to get tested right away. You're going to tell the police right away. You get a rape kit right away. What'd you say?
That you don't wait 20 years to do it, right?
Or no, or you don't even wait 24 hours. You go right away. The problem with those STDs is if you were assaulted by someone who was infected with any kind of STD, you may not show the signs of infection right away. And so that's why it's very important to continue to follow up with your doctors. And your doctor will tell you when to come back to get retested. In the meantime, if you have a significant other, I would say use protection until the retesting is negative, and your doctor will tell you when you're out of the woods and you're safe. Sometimes your doctor even gives you a prophylactic dose of medication, um, just to be on the safe side. They may go ahead and treat you for the HIV virus or hepatitis, just to kind of minimize your risk if the test is negative and you have a very high chance of having been assaulted by someone who may be positive.
What do you think about educating the people about the ways in which they can contract STDs? I mean, it seems self explanatory to us, sexually transmitted diseases. But what about the myths out there that you can catch them from public toilet seats, or that you.
Right.
So, what do you think about that?
Right. You cannot catch an STD from, well, let's talk about the specific kinds.
Okay.
Let's start with HIV.
Okay.
You cannot catch HIV by kissing someone,
Mm-hmm.
by hugging someone, by touching someone, or even by sharing a drink or a spoon, or you can't catch it that way.
Mm-hmm.
The only way to catch HIV is by having sex. Whether it's anal sex or IV drug use, you can catch HIV that way too,
So,
if you want.
gonorrhea and chlamydia are other STDs, the bacterial kind. You can catch them as well through anal sex, vaginal sex, oral sex. The other STDs are the human papillomavirus. You can catch those again through any type of skin to skin contact in the genital area. Vaginal sex, anal sex, oral sex. Pretty
Same with herpes.
Exactly. So pretty much any type of sexual activity can expose you to these diseases.
If somebody tells you, well, if I sit on a friend's toilet in her house and she had a party and a lot of people sat on the toilet, can I catch anything that way?
No,
What would you say?
no, not. And
Okay.
I mean, me personally, I wipe down toilet seats before I use them. I carry Lysol wipes with me, and I wipe down every single toilet seat before I use it, just because toilet seats are toilet seats. But
Yeah,
because I'm afraid of catching an STD from it. So
right. And me personally, I don't even sit down on any toilet seat. If I'm not at home, I don't sit down on any toilet seat. I just kind of squat or stand. Just because, like you said, toilet seats are toilet seats, but I'm not doing that because I don't want to catch an STD. How about, I've heard this question before, how about sharing soap?
is it liquid soap?
Else, if anyone has any questions specifically on things that we've said that was not clear or things that we maybe did not talk about, go ahead and reach out to us, ask us any questions that you may have, and we will be able to answer your questions.
Yes. So I guess that's all for today.
Right. See you next time. Stay safe, protect yourself, and get tested.
Yes. Bye.
Bye.